It disables and kills more Americans than any other disease. And guess what? The problem is only getting worse.
And tonight in the first part of our series, Beating the Odds, we find out why congestive heart failure is not a disease to ignore. Charlie Paget has stared death in the face more than once. He survived 3 heart attacks, but now he's suffering the consequences.
Most of my heart muscles are damaged. My heart's only pumping about 17% of its capacity.
Charlie is one of millions of Americans with congestive heart failure. It's a condition that simply means the heart isn't working as it should.
When people develop heart failure, it's because the muscle of the heart doesn't do its job. Either it doesn't squeeze normally or it doesn't fill normally.
It impacts patients' quality of life, causing shortness of breath, fatigue, and swelling all around the body. It also impacts their wallet. It's the #1 reason for hospital admission in the Medicare population. Causes of congestive heart failure are largely preventable. Heart disease and heart attacks and high blood pressure. Damaged heart valves, even viruses can also hurt muscles in your heart.
We're better at treating high blood pressure. We're better at treating coronary artery disease, so people live longer with those diseases, but eventually, frequently, the heart will fail as an end product of those diseases.
After one too many close calls, Charlie quit smoking, cut down on salt, and started taking better care of himself.
This here recently is starting to where it sort of left me with shortness of breath, and right now pretty bad cough. And so I've had to slow down a little bit.
His goal is to stay out of the hospital and keep on beating the odds. Tomorrow, in the second part of our series, we'll find out how the MUSC Heart Center helps patients manage their disease. Now, if you would like some free information about congestive heart failure, you can call the MUSC Health Connection line. There you see the number 792-1414 or 1-800-424-MUSC.
Thanks very much. Imagine not being able to do the things you used to do because you're so tired and you're always out of breath. Well, this is the reality of congestive heart failure.
Tonight, in the second part of our series, Beating the Odds, we find out how to manage the disease. He used to work with his hands, lifting and carrying heavy objects. Now even walking is difficult for George Cross. A virus weakened his heart, then congestive heart failure almost killed him.
After the doctor down there told me he couldn't do any more for me, actually he told me to go see my preacher that I was dying. But I came here and I'm still living a year, almost 2 years later.
He comes to the Congestive Heart Failure Clinic at MUSC. It's set up to closely monitor patients with severe disease, keeping them out of the hospital.
What we want to do with that clinic is to target the people that are likely to be hospitalized repeatedly or that need very intense education with regard to diet and medications and other lifestyle changes.
Chest pain? No. It takes a team of people to manage the disease. There are cardiologists, dietitians, social workers, pharmacists, and nurse practitioners like Sarah Paul.
We all work together to develop a plan for the patient and goals that we want to meet for that patient to help them and to help them help themselves.
All these people together will have ultimately the greatest impact on not only preventing congestive heart failure, but in the patient with heart failure, keeping them out of the hospital, at home, or at work, more productive, happier life.
Patients need to do their part by exercising, cutting down on salt, and taking medications correctly.
They can control their symptoms. To a degree, they can breathe easier and have more energy and feel better, and that's in their control.
Tomorrow we'll be talking about ways to treat congestive heart failure. If you'd like free information on congestive heart failure or the clinic, you can call the MUSC Health Connection 792-1414 or 1-800-424-MUSC.
It hits us where it hurts, in the chest and in the pocketbook. The cost of congestive heart failure is felt in lives and in dollars.
And tonight in the third part of our series, Beating the Odds, we find out how to treat and prevent it. As baby boomers age and people continue to ignore their risk factors, rates of congestive heart failure will keep soaring.
By all the demographics I've seen, it really looks like we're going to be in for a major epidemic, even worse than what it is now.
There's no easy way to treat it. Medications help the heart pump better and control symptoms. Surgery can correct underlying problems like valve disease or blockages in the arteries. But the only cure is a heart transplant.
In the appropriate people, it's a very good treatment modality, though, and it is proven therapy for end-stage heart failure.
John Bryant wouldn't be here today without his new heart. He's able to do things now that would have been impossible a decade ago.
Everybody that came to the hospital that's seen me, all friends and family, they look at me now, they just can't believe it. It just says it was just a miracle.
He was also the first patient at MUSC to use a new technology, a left ventricle assist device, or LVAD, to help keep his organs functioning while he waited for a transplant. But even with all of the high-tech medical equipment, the best treatment for congestive heart failure is still prevention.
We know, for example, that if we can treat high blood pressure more effectively, treat coronary artery disease by preventing it with cholesterol-lowering medications, high blood pressure, stop smoking, we'll prevent the diseases that often manifest themselves at end stage as congestive heart failure.
Now, tomorrow in the last part of our series, we will find out how you can help find a cure for this disease. If you'd like free information about congestive heart failure, you can call the MUSC Health Connection line. 792-1414 is the number, or 1-800-424-MUSC. Well, congestive heart failure is a fatal disease with no immediate hope for a cure. As the #1 killer, the odds are against all of us. And tonight in the last part of our series, we look to the future for hope. It starts with the tiniest cell and leads to high-tech treatment. Research at the Gazy's Cardiac Institute is focused on one goal.
We're desperate to treat heart failure.
While deaths from cancer are declining, rates of congestive heart failure keep soaring. Charlie Paget knows a cure will probably not happen in his lifetime, but he's taking part in a clinical trial to help someone else down the road.
Well, this particular one I'm on now is a growth hormone that they hope will let the heart grow a little bit. And if it grows some, then it can pump a little better.
By looking at everything from cells to new drugs to lifestyle changes, researchers hope to slow the progression of this disease.
We need to understand what causes the heart to fail. And quite simply, that's where our major focus of research is here at the Milk University.
And they need your help.
We have a number of patients that are suffering from congestive heart failure that may not really know that we're here for them, and that there are a number of clinical trials that they can participate in that are at no cost to them.
In this way, we're able to advance therapy. The medications I give my patients in my clinic now were part of clinical trials 5 years ago.
It takes a team effort to beat the odds, and we all need to do our part. If you have any questions about clinical trials or congestive heart failure, you can call the MUSC Health Connection, 792-1414, or 1-800-424-MUSC.